Hello and welcome to my YouTube channel. My name is Caroline and I am a registered nurse. Today I'm going to talk about a very important topic about kidney failure and chronic kidney disease. So kidney failure is a disease that is affecting more than 10% of the world's population. It's estimated that around 800 million people in the world are currently suffering from kidney failure. And of these 800, 2 million people are on dialysis or require kidney transplant in order to survive. So kidney failure is a condition where one or both of your kidneys are no longer functioning well on their own. And having a kidney failure, it means that 85 to 90% of your kidney function is gone, and they are not working well enough to keep you alive. So there is no cure for kidney failure, which we call chronic kidney disease or end-stage renal disease. There is no cure for it, but it's possible to live a long life with treatment. Having kidney failure is also not a death sentence. People with kidney failure still can live their active lives and continue to do things that they love. So I'll go into details and talk about the symptoms. I'll talk about the causes, and also we'll look at the management and also how to live when you have a kidney failure. That means that there is a multidisciplinary approach when it comes to the management of kidney failure. So I'll start by talking about the functions of the kidneys. Number one is to remove the waste products from the body. That is the most important function of the kidneys. Another one is to remove drugs from the body, balance of the body fluids. It releases a hormone that regulates blood pressure. This hormone is called aldosterone, which helps to regulate your blood pressure. It also produces an active form of vitamin D, which helps to promote strong and healthy bones. Another function is to control the production of red blood cells. Remember that the kidneys produce a hormone called erythropoietin, which is a very important hormone when it comes to the production of red blood cells. So those are some of the important functions of the kidneys. So when we look at the causes of kidney failure, there are so many causes of kidney failure. Major causes of kidney failure is diabetes and hypertension. These are the diseases that currently are the major causes of renal failure. So the other causes may be inherited, or a person who has inherited a form of, a genetic condition that affects the kidneys. And also we have congenital causes whereby a person is born with a kidney defect, which may later lead to kidney failure. So when we look at these causes, let's start with diabetes. Diabetes is a disease whereby your body does not make enough insulin or cannot use normal amounts of insulin properly. So this results in high sugar levels and a persistent rise in the sugars, and not managing the sugars well may lead to chronic kidney failure or end-stage renal disease, which we normally call diabetic nephropathy. So diabetes is a major cause of kidney failure. We also have high blood pressure. High blood pressure is a condition whereby there is a resistance in your blood vessels, and as a result you keep having high blood pressure. And then the result is that the high blood pressure, it brings complications such as chronic kidney disease, which reduces your kidney function and which may later leads to end-stage renal disease. We have a disease called glomerulonephritis, which is a disease that causes inflammation of the kidney suddenly after a person has suffered from a bacterial infection, for example, the streptococcal infection of the throat. Someone may get well, but later the bacteria may end up causing inflammation in the kidneys, and this one usually ends up causing kidney diseases. Kidney failure. And also, this one is something that may not happen immediately, but it takes several years, and it may cause progressive or slow loss of kidney function. This is the most common inherited kidney disease. This one is usually characterized by formation of kidney cysts that enlarge over time. This one may cause serious kidney damage and even kidney failure. So when you have polycystic kidney disease, it can also lead to kidney failure over time because of the formation of those large cysts. We have another cause which is kidney stones. This one is most common, especially when you have a problem with calcium. Most of the kidney stones are caused by excess calcium. So the stones build up, causing obstruction in the urinary tract, and this one may cause a buildup of urine and a backup of urine into the kidneys, leading to hydronephrosis and eventually causing damage to the kidney cells, causing kidney failure. Sometimes medications can be used to prevent recurrent formation of stones, and in case you have large stones, they may be removed. They may be removed surgically, and they may also be removed. They can be broken into small pieces, and then you just pass it out through the urine. We have another cause of kidney failure, which is urinary tract infections. This one is an infection that affects most people. You'll find that when you have urinary tract infections, especially those ones caused by bacteria, can really cause damage to the kidneys. This one, the bacteria may ascend and get to the kidneys and cause inflammation, which may progress to kidney failure over time. So some of the symptoms that you may have when you have a urinary tract infection is like burning sensation when you're passing urine, excessive urination, and an urge to pass urine. And also you may have fevers, nausea, which may also be some of the signs that you have a urinary tract infection. If you have these symptoms, it's better to get checked just in case you have a serious bacterial infection that can ascend to the kidneys and cause a kidney problem. We have other causes, which is congenital diseases. This one is a malformation that occurs in the urinary tract system, especially to the newborn. As they develop in the womb, there is this malformation that may happen. So when kids are born with malformations in the urinary tract system, it may lead to kidney failure because their system may not be functioning properly, which may lead to backup of urine or failure of the baby to pass urine properly. This one causes pressure and buildup of fluid in the kidneys, which may lead to hydronephrosis, and eventually it may cause kidney failure. So those are some of the causes of kidney failure. Another cause that I wanted to talk about is drugs and toxins. There are some drugs that are toxic to the kidney. So when you take them, they may cause damage to the kidney cells, and especially some of the over-the-counter medications that people like to take without prescription. Some of these medicines are very harmful to the kidney, so you should be very careful. When you are buying medicines, it's good to get advice from the doctor so that you know which medicines are safe to take and which ones are very toxic to you. So some of these medications can be toxic to the kidney and they may lead to kidney failure. So I'll talk about the symptoms. What symptoms will you have when you have kidney failure? One of them is poor appetite. You'll feel weakness, you'll feel tiredness or fatigue. You'll also start itching. Your body will start itching when you have a kidney failure. You'll also lose weight. You'll start getting muscle cramps, especially on the legs. And then there is swelling of the feet and the ankles, and anemia, which is low blood count. You will also have insomnia, which is trouble sleeping in the night. Those are some of the symptoms that you may have when you have kidney failure. So diagnosis of kidney failure, it depends on the on how your doctor assess the situation, but you may be told to run a series of tests. For example, you may do a blood test to check your UECs, which is urea, creatinine, and electrolytes level. So there is a marker called creatinine, which is an indicator that your kidney is either working properly or not. So those are some of the blood tests that you may do. You may also have a urinalysis test just to check your urine and detect any abnormalities about your kidney function. You may do imaging tests, for example, ultrasound. You may do a CT scan, you may do MRI, just to visualize your kidneys and detect whether there is any abnormalities, especially for the polycystic kidney disease. This one can be seen when you do an ultrasound or a CT scan. So another test that you can do is a kidney biopsy, where a small tissue of your kidney is taken and it's taken to lab for analysis to check whether the kidney cells are working properly. So those are some of the tests that can be done when you want to detect kidney failure. So management of kidney failure it involves a combination of multidisciplinary approach. This one includes medical management, we have dietary management, lifestyle changes, and ongoing support. So it's important to note that managing kidney failure is not just about going for dialysis or having a kidney transplant. There are so many issues that are involved which has to be taken care of as you manage the kidney failure. This one may include specialists like nephrologists, dietitians, nurses, and other healthcare professionals to help you manage your disease properly. So some of the medications that the doctor may prescribe for you include phosphate binders. Phosphate binders, this one helps to control the phosphorus levels in your blood. We have erythropoiesis stimulating agents. This one helps to stimulate the kidney to produce erythropoietin hormone, which is involved in the formation of blood cells. Um, Other management is about blood pressure medications. Remember, when your kidneys are affected, you will always have a problem with your blood pressure. So, blood pressure medications may be prescribed just to manage the pressure and bring the high blood pressure down. You may also be put on dialysis depending on how severe your condition is. So dialysis is whereby you are connected to a machine and then your blood is cleaned through the machine and the waste products are removed. This one may be done several times a week or even once a week, depending on how severe your condition is. The doctor may decide how many times you will require the dialysis. Another management is transplantation, whereby you will have a kidney transplant, where this is whereby in cases whereby the kidney damage is irreversible, you may be considered for a kidney transplant. So other management include lifestyle changes, for example, dietary modifications. You limit sodium in your diet and then also reduce the amount of protein that you take. You should also control the phosphorus and potassium in your diet, which helps to, some of these minerals may affect your kidney. So managing them is very important. That is why you really need a dietitian on board to help you manage your diet. So another management is fluid management. When you have kidney failure, you have buildup of fluid. So fluid management is whereby you restrict the amount of fluid that you take so that you don't have a buildup of fluid which may lead to edema. And also you should limit the amount of alcohol and caffeine in your diet. So regular exercise is also very important. You should do moderate physical activity, which helps to maintain overall health and also can improve your cardiovascular fitness. You should also stop smoking if you're a smoker, which may worsen the kidney function, and smoking can also increase your risk for cardiovascular complications. You should also be on follow-up. Make sure that you have regular checkups just to check your kidney function and to detect any buildup of toxins in your body. So laboratory tests, that these ones can be done regularly just to check how the electrolytes are, your creatinine levels, your urea, your nitrogen levels, just to make sure that we are on the right track, you are on the right track in managing your kidney disease. So the patient should also be educate the patient so that they are able to understand their condition, their treatment plan, and the importance of adhering to the dietary and medication recommendations. Emotional support is also very important. Counseling, remember that chronic kidney disease or end-stage renal disease is a chronic condition that a person lives with, and this one can really affect a person psychologically and emotionally. So counseling is very important, whereby you provide emotional support and also help the patient to cope with the challenges of kidney failure. Um, Also address anxiety and depression, and you can also join support groups to help you cope up with the condition. Interacting with people who are going through the same challenges is very important, and this one will help you to cope and also to to have a positive mind and also a positive outlook in your condition. So uh, Ensuring coordination between the healthcare providers is important. Remember that the doctors, the nurses, the dietitian, they are working together to manage these conditions. So ensuring coordination between the healthcare providers is very important, especially when you have a patient who has other diseases like hypertension, diabetes. Remember, these are professionals who are all on board to manage this condition, and the goal is the same, to make sure that the patient gets well and they get better treatment. So thank you for joining me today. If you liked my content, you can like, share, and subscribe. And if you have any health topic that you would like me to talk about, you can always drop it in the comment section, and I'll make sure to make a video about it.